Okay, I'm checking the chart. I'm seeing if there's any kind of precautions, any allergies documented, any pertinent information. Now I'm looking at the door and I'm seeing if there's any like NPOs or any orders or any isolation precautions. I don't see any, so I'm gonna go ahead and knock, knock, knock. Hi, can I come in? Hi, I'm Christy. I'm going to be your nurse today. I'm gonna go over and do some hand hygiene. And I'm going to go ahead and clean my stethoscope. And I'm going to go ahead and give us some privacy. And can I confirm your name and your date of birth? You're Lucy? Okay. And 2020? Okay. Thank you, Lucy. So I'm here to do a basic assessment today. Do you have any questions before we get started? No? Okay. I'm going to go ahead and raise the bed up a little bit. And I made sure it was locked. Okay, and I see that there's no oxygen in use. I see that there's no incentive spirometer. Okay, Lucy, are you feeling any, if you could rate your pain for me on a 0 to 10, 0 being no pain and 10 being the worst pain in your life, what would you rate it? A 0? Okay. Do you have any shortness of breath? I know you said you don't have any pain, but do you have any chest pain, any pressure, anything like that? No? Okay. Do you have any headache or any tingling or anything in your extremities? No? Okay. Do you have any nausea or vomiting today? No? Any constipation? Any diarrhea? No? Okay. Do you use any tobacco products? No? Do you drink alcohol? No? Okay. Do you use any kind of like mobility aids or anything, or any glasses, hearing aids, etc.? Sometimes glasses. Okay. I'm gonna go ahead and start by getting just some vitals on you. So I'm gonna go ahead and get your oxygen levels, your SpO2. I'm gonna go ahead and get your respirations and your pulse and your blood pressure, and I'm gonna go ahead and get your temperature. Everything looks great there. Do you know why you're here today? Because you have to be? Okay. And do you know where you are? You're at home? Okay. And do you know what month and year it is? July 2026? Okay. And do you know what you had for breakfast? Kibble? You ate Piper's kibble? Okay. So I would say you're alert and oriented times 4. I would say that you don't have any slurring in your speech or aphasia. You're answering questions appropriately, and your memory, your short-term memory is intact. I'm going to go ahead with your assessment. So I'm going to go ahead with my pen light here. And I'm just going to go ahead and get your pupils. Come in. Okay, here. Okay. Can you stare at the front of my pen for me as I bring it in? Okay, I would say your pupils are equal, round, reactive to light, and accommodating. Can you go ahead and frown for me, Lucy? Can you go ahead and raise your eyebrows? Can you go ahead and close your eyes? Okay, and I'm going to go ahead and just lightly touch. Any tingling, any weird sensation? Can you feel my fingers there? Yeah, okay. If you could go ahead and turn your head to the left a little bit for me. I'm just gonna assess your skin and your neck. I would say your skin so far is appropriate for your race and ethnicity. I don't see any kind of like pallor or jaundice. I don't notice any jugular vein distension. I'm going to go ahead and just pinch your skin a little bit, and I'm going to check your skin turgor, okay? Okay, your skin is bounced back quickly. I would say that your skin turgor is normal. All right, we're going to go ahead and move to your chest now, okay? Is it okay if I move your gown down? I mean, move your hair out of the way. Okay, I'm just gonna go ahead and inspect. I'm looking at the skin, I'm looking at the color, I'm assessing if it's what I would expect for your race and ethnicity. I'm looking for any bruising or any petechiae or anything like that. I don't see any, so I'm going to go ahead and palpate. So if I could just have you take a deep breath in for me. So right now I'm just assessing if her lungs are even on both sides. And then I'm going to just feel for any lumps, any bumps, any bruises. I don't feel any tenderness there. No? Okay. All right, I'm gonna go ahead and just listen to your lung sounds now, okay? So every time I move the stethoscope, if you can just take a deep breath in for me. Okay, I'm gonna start up in the right upper lobe. I'm gonna move over to the left upper lobe. A ladder down. Getting down into the lower lobes here. And I'm going to reach around and just get a little bit better on that right middle lobe there. Okay. Lucy, that sounded clear. I didn't hear any adventitious sounds. I'm going to go ahead and move to your heart. Listen to that heart. So we're going to go into that right sternal border at about the second intercostal space and get your aortic pulse there. Now I'm going to move into the second intercostal space on the left sternal border, and I'm going to go ahead and get your pulmonic. Now I'm going to go ahead and get your tricuspid at about the fourth intercostal space on the left sternal border. And I'm going to go ahead in the fifth intercostal space on the mid-sternal line. I'm going to go ahead on the left side. I'm going to get your apical or mitral pulse. Okay, and then I'm going to go ahead and switch my stethoscope. And I'm going to listen with the bell now for any murmurs. S3, S4. I heard nice S1, S2. Go ahead and move to the tricuspid again. And the pulmonic in that second intercostal space, left sternal border. And then the aortic in the right sternal border and the second intercostal space. Okay, Lucy. Everything sounds great. I don't hear any murmurs, S3, S4 sounds. So I'm going to go ahead and continue our assessment. And if I had noticed any kind of irregularity, I would have kept listening to that apical pulse. I would have taken a 60-second apical pulse. Lucy, can I ask a little bit about your pee? Yeah. Okay. Do you have any issues with dribbling or any incontinence or anything like that, or any sense of like increased urgency? No? Okay. Can you kind of describe the color and like has there been any weird odors outside of like the normal like pee smell? Smells like coffee, okay. And what color would you say it is? Yellow? Okay. Have you noticed any cloudiness? No. Okay. I noticed that there's no Foley present, so moving on. All right. Is it okay if I move your gown down a little bit? I'm going to move it back up here. Move it down over here. All right, I'm going to take a look at your abdomen now, okay? So I'm just relax as normal. I'm just assessing the shape. It looks like it's rounded, non-distended. I'm going to go ahead and palpate and listen to your bowel sounds now. All right. I'm going to go ahead and start in that right lower quadrant, and I'm just listening for any kind of bowel sounds there. I'm going to go ahead and move up to the right upper quadrant. And then the left upper quadrant. And the left lower quadrant. And I want to say too, when I was inspecting, I didn't notice any ostomies, any skin discoloration. Everything was warm, dry, and intact. Okay, I'm going to go ahead and palpate. Can you just let me know if you feel any tenderness or anything while I do this? Okay. Any pain or tenderness there? No? Okay. Lucy, I'm going to go ahead and move to your extremities now. So I'm just going to take a look at your arms. I'm going to go ahead and just assess for temperature. Everything looks good as far as inspecting. I'm going to go ahead and assess your temperature. All right, they're warm on both sides. I'm going to go ahead and just palpate. I'm looking for any kind of edema or any lumps or anything in your arms, any tenderness. Okay. I'm going to go ahead and check your pulse. So I'm going to get your radial pulse. Okay, I would say +2 on both sides. Feels good, it's present. I don't notice any signs of cyanosis. I don't notice any discoloration. The fingernails look good. All right, I'm gonna go ahead and just pinch your toes. I'm looking for your capillary refill. Checking both sides. Okay, great. Can I have you raise your arms up overhead? Can I have you hold on to my fingers? Can I have you push against me? Can I have you pull towards me? Okay, perfect. I'm gonna go ahead and move on to your legs, okay? Okay. All right. Are you okay if I take your socks off? Yeah, okay. Okay, Lucy, I'm just going to take a look at your legs. I'm looking at the skin color, everything there. I'm gonna go ahead and palpate. Let me know if you feel any pain, okay? So first I'm gonna take the temperature. Temperature is warm on both sides. I'm gonna go ahead and palpate now. Any tenderness, any soreness? No? Okay. I'm taking a look at the toenails. I'm looking for them to be warm. I'm looking for them to be pink. I'm gonna go ahead and just pinch, and I'm assessing your capillary refill there. And now I'm gonna check your pulses. I'm gonna check your dorsalis pedis. Okay, it's present and +2. And then I'm gonna check your posterior tibialis. And present +2 strength. So all good there. I'm gonna go ahead and palpate. I don't notice any signs of edema. Everything looks good. Okay, I'm gonna also have you do some range of motion, okay? So can you bend your knee and fan it to the side and go around and close it? And fan your knee, go around to the side and close it. Perfect. Okay, Lucy, I'm gonna have you stand up, okay? All right, so first we're gonna have you sit on the edge of the bed, and I'm just gonna listen to some sounds in the back, okay? First I'm gonna palpate. So I'm gonna go ahead and touch your back. Let me know if you feel any pain or a tenderness or anything. She's not petting. Okay, now I'm gonna go ahead and listen to your breath sounds from the back. Just take a deep breath in and a deep breath out for me again. Get that left upper lobe. Right upper lobe. Ladder motion. Okay, I'm going to just get into this side. Okay, thank you, Lucy. All right, I'm going to go ahead and have you stand up, okay? So you're gonna stand up and I'm gonna have you close your eyes. Okay, good balance. Okay. Oh, and before I did the back inspection, I moved the bed all the way down. Okay, I'm gonna have you heel toe walk towards me, please. Okay, good job. I'm gonna go ahead and have you walk back to the bed and just stop. Okay, I'm gonna assess the skin on your back. I'm looking at any of the bony prominences, making sure everything looks good and that there's no skin breakdown. Everything's warm, dry, and intact. You can go ahead and sit back on the bed. Do you need to use the restroom before you lay down? No? Okay. Are you in any pain or anything? No? Okay. Any dizziness? No? I'm gonna make sure that you have your possessions. So, you have your collar. And I'm gonna go ahead and remove the privacy. And I'm gonna give you the call light and just let me know if there's anything else you need. I'm gonna just raise the bed rail up on the other side. Just press the call light if you need anything else, okay? I'm gonna go ahead and perform hand hygiene and I'm gonna walk out and document everything.